We all understand that people worry a lot about leaving their animals for anaesthetic. What we'd like to do today is talk you through the process and show you how we look after your pet when they're asleep. Anaesthesia is a special interest of mine, and as a result we only use the best anaesthetics at this surgery, and we also use state-of-the-art monitoring just to try and keep your pet as safe as we possibly can. This is Sable. Sable's coming in for a dental today, and she's an older lady, so we treat her with special care. When you come in the morning with your pet, we will ask you a series of questions pertaining to your pet's general health. We may ask you if they cough, if they drink excessively, if they've lost weight, if they can go for a good walk. All of these questions give us vital information about your pet's general health. We would also give your pet a clinical examination, which allows us to pick up various health issues that you may not have noticed yourself when you're with your pet day to day. Sable, being an older pet, will have an intravenous drip when she's asleep. We also give her special doses of drugs to make everything safer for her when she's coming in to be with us. At the moment you can see Sable's very sleepy. This is because she's had a pre-med, which does two things. It allows her to be nice and relaxed like this, so she's not stressed about being with us. And the other thing it does is allows us to give her minimal doses of drugs to get her to go to sleep in the first place, which again makes it all nice and safe for her. We're now going to take her through to the theatre area, and that will be where we actually put her to sleep and keep her asleep while we carry out our procedures. What we're going to do now is we're going to put Sable on her side, and we're going to give her something to make her go to sleep. Okay, so this is actually the drug that sends her to sleep, and she'll just drift off to sleep.
Good girl. Good girl.
That's a good girl.
Good girl.
She just feels a little bit funny and then goes to sleep. Take a glass. Now we're putting a tube down her throat to help her breathe during the anaesthetic. Okay. And she gets linked up to a machine that gives her both oxygen and also an anaesthetic gas to keep her asleep while we do whatever we need to do with her. Okay, that's fine. Now Emma's going to put something called a Doppler on her foot. This is the Doppler monitor that we put on her foot. It recognises pulsation of a blood vessel underneath the little probe that you can see here. So we use this device to, first of all, hear a pulse at the bottom of her foot, which basically tells us that the blood circulating in her foot is adequate. And that actually gives us a very clear indicator as to whether all the blood going to her internal organs is adequate, which is a very reassuring thing to know. The other thing that we use this for is we use it to help us take the dog's blood pressure. In a minute when we transfer her to theatre, what we'll do is put a cuff on her leg above this Doppler probe, and basically when you cuff this up, you can get a reading for her blood pressure. So if I use my hand here and I compress that, you can hear that the pulse disappears. And what we do is we cuff up this little bit here and release it, and that gives us a value for her blood pressure. And her blood pressure came in at just under 100 there, which is absolutely fine for a dog of her size when she's asleep. Right, okay. Here we have Sable in theatre. We have a lot more monitoring when we have the animals in theatre. The first thing we put on is an ECG. These are the leads here, and they're connected up to this ECG machine here. Basically what we're doing is looking for abnormal rhythms under anaesthetics. Little strange rhythms are quite normal, because obviously it's not a normal situation that the dog is in. But we're looking for good rhythmic output by the heart, which we're getting with her, so we're quite happy with her. She's still on her intravenous fluids, and the rate that we give that to her depends on her blood pressure and how deep she is, how long her surgery is, that kind of thing. She's still got her Doppler and her blood pressure monitor attached. She also has a little probe here that attaches to her tongue, and basically that gives us a reading of how saturated her blood is with oxygen. So we can tell if there's any problems there at all. Hers is 99%, which is absolutely fine. We have her anaesthetic going into her here. There's an agent that is suspended in oxygen, and we can control the amount of that she gets through this dial here. The last thing that we have here is a machine that measures her carbon dioxide output and input. And this is a very, very valuable tool because it basically tells us if she's too deep or too light with her anaesthetic. And it allows us to see if she's rebreathing any of the anaesthetic gases, which we don't want to happen. So it allows us to check all of these things when she's asleep. So basically we have all angles covered when they come through to theatre. For an older animal like Sable, obviously they are treated slightly differently, and their drug doses are far lower than you would use for a young, fit, bouncing animal. So we will now proceed on with Sable's procedure.